Hello everyone, this is Dr. Rajani ji, Assistant Professor, Department of Materia Medica. Today we are here to discuss about Brom. Brom has been proved, but the greater part of the pathogenesis is made up of symptoms observed in allopathic overdosing, to which are added symptoms cured in the practice of homeopaths. So this was actually not proven, proven but not thoroughly, so that we do not get mostly all of the symptoms from the proving, but also from the pathogenesis which was observed from the allopathic overdosing. Brom has mostly the profound actions on the generative organs and the mental side of the generative sphere. So mostly on the sensual, lascivious fancies, satyriasis, which is uncontrollable desire in male, and nymphomania, and finally impotence and wasting of the sexual organs. Other than that, what we see is in the cases of epilepsy. So it is curative mostly when this is associated with sexual excesses or abuse in men, and those in which the fits occur during or near the menstrual period in women. Next, what you see is it is indicated mostly in the epilepsy cases occurring at the new moon and when headache follows the fit. So there will be epilepsy mostly occurring at the new moon, and then there will be headache followed by it. With that, so in a spasm it will be from fright, anger or emotional disturbances in nervous plethoric patients, and also during the parturition, dentition, whooping cough, and in Bright's disease. Acne also has a very much important aspect to be seen in this one. So there is a definite relation to the sexual organs being especially noticeable at puberty and in women at the menstrual period. With this, there is marked symptoms seen in the moral and intellectual faculties. So that is greatly disordered, and hence the memory is lost. There is now the thing is how it is lost. The memory is lost, but in which way it presents? They forget how to talk. Aphasic has to be told the word before he can speak it, so they forget about the pronunciations also, right? Depression would be there, melancholy, uncontrollable weeping, feels as if they would lose their minds, restlessness and sleeplessness from worry. With this, we also have fidgety hands, so fingers must be playing with something, and twitching of fingers cannot sit still. There is melancholic delusions, feeling of moral deficiency, religious depressions. Also, they have delusions of conspiracies against him. They imagine that he is singled out as an object of divine wrath, must do something, move about, and they get fidgety. If you talk about fear, they have fear of being poisoned, like Alzheimer's. Active delirium and night terrors are also present. In children especially, from overexcitability of brain from worry, drowsiness in one of the notes of the drug, so drops asleep in his chair, and if aroused falls asleep again immediately. So whenever you wake them up, they fall asleep again immediately, even in the chair. This deep sleep may be broken by a start, though waking is very difficult. Dreams, if you talk about, it's very much confused. In connection with ovarian tumors or other affections, or independently. Brom is more particularly adapted to persons inclined to obesity, to children, to nervous women. More symptoms have been noted on the right side than on the left. Remarkable sensations, if you talk about, parts feel as if growing large, and paroxysm of numbness. They also feel as if needles were pricking him. trembling sensations, marked periodicity appears in the symptom, which itself relates to the drug to epilepsy. Uh, Symptoms recur paroxysmally every 2, 3, or 24 hours, twice a week, fortnightly, or at new moon. At here in the winters are to be seen. Causations, if we talk about, the causations mostly remain anger, fright, emotional disturbance, worry, business losses, and embarrassments, sexual excesses, sexual abuse. So, mental symptoms we already have spoken, right? Hallucinations we already have seen. Now, coming to the headache symptoms, there is suicidal mania with tremulous and flushed face, numb feeling in the head, brain fog would be there, anemia of the brain from loss of fluids, bad results from overtaxing brain, especially with grief or anxiety, drooping of the head, so they cannot hold it erect, constrictive sensation in the brain as if too tight, and staggers as if drunk. Although they are not drunk, but they stagger like drunkards. And along with the dizziness and confusion and heat of the head. Severe throbbing, aching pains in occipital region, extending down as far as dorsal region also. So cannot sit up or walk, and they cannot shake their head. Next, what we see is dim vision, sunken eyes. So fixed gaze would be there, eyeballs moving in every directions, squinting after night terrors of children, difficult speech, action of tongue is also being slowed down and difficult after waking, mostly stammering is being seen. If you talk about tongue, it's red, dry, enlarged red, and later dry and brown. Taste, mostly foul, salty taste, and thirst intense with dry mouth. Children who from the birth time of birth can swallow solids with ease, yet choke every time they try to drink. So drinking is difficult, whereas on the contrary, solid food particles can be swallowed very easily, especially in the hysterical moments who can vomit their food after each meal, right? That too after the emotional excitability. And also drunkards also it's being seen, vomiting is being seen in the drunkards after the debauchery. Enlargement of the liver and spleen, there is tumors also, small mostly in the region of spleen, internal coldness of abdomen along with the abdomen sunken and almost stuck to vertebral column, especially in the cholera infantum is being seen. Asiatic cholera, that is first stage, vomiting, cramps, rice water discharges restores the secretion of urine, and painless diarrhea with great chilliness even in a hot room. The stools mostly watery like rice water, bloody mucopurulent diarrhea with intense thirst, and limbs, if you say, they have like weakness of the legs, so they cannot stand erect, unsteady gait, frequently taken for a drunken man, so they stagger. Loss of sensibility, so pinching or burning, they do not have any sensation. Locomotor ataxia is being seen. Now, other than this, also we see that in females there is pruritus vulva, debility and impotence in the male part, and ovarian neuralgia with great nervous uneasiness to be seen in the females, with exaggerated sexual desires and cystic tumors of ovaries. On the other hand, if you talk about the male symptoms, as I have said that they have debility and impotence along with effects of sexual excesses, especially from loss of memory and impaired coordination. Urinary symptoms also, you see that there is sensibility of urethra diminished, urine profuse with thirst, and diabetes is also seen. Extremities, we see that they have fidgety hands, so busy twitching of fingers, jerking and twitching of muscles are to be seen. Sleep would be restless, extreme drowsiness, so they sleep. There is sleeplessness due to the worry and grief and sexual excesses also. Grinding of teeth is present in the sleep. Somnambulism is also being seen. Modalities, if you talk about, they feel better when they're occupied. Mostly, in any ways, if at all mentally or physically. So, however, if at all they are mentally busy or physically busy, it it ameliorates the complaints in the patient. This is all about Kelly Brom. We'll talk about some other remedy in the different class. Thank you.